Welcome everybody to Brookings. My name is Martin Bailey. I'm a senior fellow here at Brookings, and this meeting is part of an ongoing series on retirement policy reform, which is a joint effort with Brookings and the Kellogg School of Management. This project has been funded generously by the Alfred P. Sloan Foundation and the Laura and John Arnold Foundation. Ben Harris and I lead this project. Ben is the executive director of the Kellogg Public-Private Interface. In January, we held a meeting at Brookings on working longer, and in June we held a meeting at Kellogg on annuities. The papers from those events are on the Brookings website. In the spring, we'll be holding another meeting on working longer, looking at the impact of the changing labor market on older workers. And we have just recently been awarded additional funding by the Smith Richardson Foundation to turn the results of this project into a retirement policy book. There's a lot of interest in retirement policy, especially in thinking new ways to help people live more secure and stable retirements. The old retirement paradigm involved company pensions plus Social Security and Medicare. Today, defined benefit pensions have all but disappeared, and Americans on average are living longer. Together, this means that Americans now have to take more responsibility for funding their own retirement. And if fiscal pressure put on Social Security and Medicare leads to cuts, retirees will have to take on even more of this responsibility. Unfortunately, many households are reaching retirement age with low levels of financial assets and may be forced to live off Social Security benefits that are not very generous. A portion of these households have accumulated substantial equity in their homes, raising the possibility they could draw on this equity to help them consume more in retirement or just deal with unexpected expenses, especially healthcare costs. Some will decide to sell their homes and realize the equity that way, but others would much prefer to continue living in their old neighborhoods with friends or family nearby. Reverse mortgages are one way for families to tap into their home equity. Are they a good idea, or do they impose high costs on older people? Which families stand to benefit most from such mortgages, and which families should avoid them? Can the reverse mortgage market work better? We are fortunate today to have a very distinguished group of experts to talk about these issues, and we are releasing 3 papers on the Brookings website. The authors of 2 of these papers, Stephanie Moulton from Ohio State and Thomas Davidoff from the University of British Columbia, are here and will present their insights into this market and suggest proposals to improve the way it works. The 3rd paper is by Ben Harris and myself and is meant as an overview of the topic. We will not present that paper today, but it is available on the website. Also here are distinguished experts Chris Meyer from Columbia University and Laurie Goodman from the Urban Institute. They will comment on the papers and give their own views on the reverse mortgage market. It's hard to imagine a better group, and we're lucky to have them. Starting us off is Deborah Whitman as AARP's Chief Public Policy Officer. She leads policy development, analysis, and research, as well as global thought leadership. She oversees AARP's Public Policy Institute, AARP Research Office of Policy Development and Integration, Thought Leadership, and AARP International. Prior to her position at AARP, she was staff director for the U.S. Senate Special Committee on Aging, and she worked for the Congressional Research Service as a specialist in the economics of aging. Now, don't want to miss this last one out. From 2001 to 2003, she served as a Brookings Legis Fellow to the U.S. Senate Committee on Health, Education, Labor, and Pensions. Dr. Whitman is widely quoted in the media, and she serves on several boards. She holds a master's and doctorate degrees in economics from Syracuse University. After Dr. Whitman speaks, she will take questions from the audience. Then the authors will present their papers, followed by a panel discussion moderated by Ben Harris. It's my pleasure to introduce Deb Whitman. Thank you so much for coming.
Good morning, everyone. Thank you, Martin, and thank you, Ben. What I really like about what you're doing with this series is that you're showing us new solutions, both to help people work longer, to make their money last, and today's topic, to use their assets in their house to improve their financial security. Because I believe that we need more solutions, and we need them now. This morning, I'd like to highlight for you some of the realities that people face when it comes to retirement security. Unfortunately, it's a pretty bleak picture. I believe there's far too many cracks in our system.
Could you pull the mic a little closer?
Absolutely. Is that better? Let's try that. There are far too many cracks in our system. Social Security hasn't been touched since the 1980s. Our retirement system leaves nearly half of the population uncovered, and rapidly growing healthcare costs eat away at what people do have saved. In the US, we have a do-it-yourself retirement system. It's hard to plan, it's hard to navigate, and our support systems are inadequate. And this is leaving many Americans feeling very unprepared. According to a 2018 Retirement Confidence Survey, over 60% of Americans under age 50 say that preparing for retirement makes them feel stressed. While I know that today's papers are focused on the reverse mortgages, I want to provide a broader view about how financially secure Americans are in retirement. As I said, we have a DIY retirement system. There are so many cracks that people can fall through, and we have many warning signs that people are falling through those cracks. Here are my top 3 signs to look out for. First, 4 out of 10 families with a breadwinner in their prime earning years have no savings for retirement at all. Second, added years of life are bringing added years of expense. Healthcare costs in retirement are often in the hundreds of thousands of dollars, and that's not even including long-term care costs. According to the Employee Benefit Research Institute, they estimate that a retired couple will need to have saved roughly $300,000 just to cover healthcare expenses in retirement. And that's even higher if they have expensive prescription drugs. More older Americans are facing a large burden of debt. A few years ago, a paper by AARP's researcher, Dr. Lori Cherwinski, found that the fastest rate of foreclosures increasing was for people over age 75. Imagine losing your house at 75. For a great many of adults, a sense of security seems out of reach in retirement. They haven't saved enough, they don't have much income, and even if they have saved something, they don't know how to make it last. While the middle class has good reasons to feel anxious about the future, these problems threaten the financial well-being of people who have worked their entire lives, and even the wealthy are not immune. But I want to emphasize that all challenges are not equal. For millions of low-income Americans, including women and disadvantaged groups, retirement security is an elusive dream. We all know that many women devote time during their working age years to care for families. They could take extended leave from work to raise kids or provide care for a loved one like their parents. And when they're older, that translates to less in savings, less in benefits, and less in income. So it's no surprise that many older women end up near the poverty line or even below it. And this is even harder because women live longer than men, roughly 2 years longer at age 65. So if you look at retirement security through a racial or ethnic lens, you see particular challenges. According to the data from the Census Bureau's current population survey, the poverty rates for older whites was 6%, yet for older African Americans, that rate just soared to 18%, and for older Hispanics, it was 16%. Now, I've been speaking broadly so far because it's important to look at retirement security in a holistic way. But I want to take a few minutes to focus on the critical resources that people have or need to be financially secure as they age. I'll start with Social Security. For most older adults, this is the single most important financial resource, and for many, it is the only resource they have. The good news about Social Security is the benefits last as long as you do, and they protect you against inflation. Further, they're progressive, which provides some help for lower paid workers. But as critical as they are, benefits are modest. The average retired worker gets less than $18,000, and it can be significantly less. Yet in many cases, that payment has to cover everything. I'm not sure I could survive on $18,000 a year in Washington, D.C. I'm not sure about you. For many people, that's all they have. About 17% of older Americans rely on Social Security for 90% or more of their family income. Among older African Americans and Hispanics, it's more than 1 in 4. The meagerness of Social Security also highlights the needs for holistic solutions. AARP worked with Kaiser Family Foundation on a study that found by 2030, out-of-pocket healthcare costs will eat up half of the typical Social Security check. Half of your Social Security check will be coming to cover your Medicare premiums, your out-of-pocket costs, and other expenses. And those numbers get worse the older and sicker you are. Right now, if you're over 85, about 71 cents of every dollar you get from Social Security is needed to pay for your out-of-pocket healthcare costs. By the year 2030, it's headed for 87 cents of every Social Security dollar you get. That would leave just 13 cents for all other necessities. I do not know how you'd pay for your heating bill, your housing costs, and other things. So Social Security is a pillar that needs reinforcing. The latest trustees report found that in 2035, which happens to be the year I turned 65, so I care about this greatly, benefits will be cut by 20% unless we do something. Some proposals on Capitol Hill would cut benefits substantially. Other proposals would cut benefits not at all. Inaction by politicians makes it really hard for any of us to prepare for our future and know what we will be getting. Now, while Social Security is the foundation of financial security and retirement, we know that for most people it's not enough. As Martin said, defined benefit pensions, which really provide real protection, are unfortunately fading into the past. That means that building a nest egg is a crucial part of any plan for retirement security. Yet we have an abysmal saving system in this country. Even if you want to save, it's really, really hard. About half of the labor force has no access to retirement plan at work, and many of the plans that do exist are not adequate. Uncovered workers are often young, female, African American, or Hispanic. They're typically lower paid. Many are employed by small business or part-time or work part-time. Now, this is completely unacceptable in today's age. Other countries have national plans that cover all citizens for their entire life, and we need one here too. For too long, the federal government has ignored the coverage gap, which is why so many states are starting to get into the action, offering workers a way to save when their employers don't have a retirement plan. Currently, more than 30 states are considering retirement savings plans, and 7 states are already implementing them. States like California, Oregon, Illinois, Washington, Maryland, Massachusetts, New Jersey, Washington, I already mentioned, all have passed legislation, and another 22 states across the country have legislation been introduced. This is really exciting. This is the best thing happening in retirement security, I think, going on in the United States. But it also isn't ideal. The amount that people can save is based on IRA contributions, so it's too small. And the differences between jurisdictions can be confusing. For example, New York City and New York State may have 2 different plans. Now, for families that do have retirement savings, the amounts are often too small. Overall, the median value for those aged 31 to 62 is a piddly $5,000. For those with savings, they often don't roll over the savings when they change jobs or they take money early. Perhaps a third of workers take cash out of their retirement accounts to use in the present. So from easy fixes, we need everyone to have access to workplace savings with a payroll deduction. Second, we need employees to be enrolled automatically. And third, savings rates should be increased as a worker's pay goes up. In shorthand, auto. We need to make it easy for everyone. The do-it-yourself retirement plan presents hazards. Consumers need to keep their eyes open, presents other hazards. Consumers need to keep their eyes open when they work with a financial advisor. They should ask lots of questions when they know and make sure they know about hidden fees, which can really add up. ARP supported the requirements that financial advisors serve as fiduciaries, and we're extremely disappointed that the government reduced those standards. So even for those who have saved, it's hard to know how to make their money last for up to 40 years of retirement. The broader point is that we put too much on individuals to build, safeguard, and make our nest eggs last. In addition to changes in federal policy, the private sector can really help. A growing variety of guaranteed lifetime income products can serve the real need on making a nest egg last. But these options should be more widely available, easy to understand, and provide a better value for the saver. Surprisingly, one of the most widely used strategies to ensure financial security in retirement is actually to work. This enables people to hold off claiming Social Security. It can help you steer more into your income into your savings. It reduces the price tag on retirement because you have fewer years to cover. And this is exactly what we're seeing. For men aged 65 and up, labor force participation in 2018 was 24%. This is a level not reached in almost 50 years. We know that many enjoy the social aspects of the workplace, but when ARP surveyed older adults on why they kept working, 87% said it was because they need the money. Unfortunately, the option to work longer is not available to everyone. Personal health issues or the need to care for a loved one force many people out of the labor force, sometimes a lot earlier than they planned. We also see that workers with less education run into major obstacles. But I want to call attention to a barrier that affects workers at all levels of income, skill, and health, which is age discrimination. It's a serious problem in our culture. According to ARP research, 61% of adults age 45 and older believe they have seen or experienced age discrimination in the workplace. 61%, age 45 and older, have seen or experienced age discrimination. Being out of work presents particular challenges. In fact, older job seekers face longer periods of employment than younger workers, and when they do get a job offer, they often have to settle for a big pay cut. Rising debt is another reason nearly half of people under age 50 say they're having a hard time preparing for retirement. And let's not forget that rising debt is also happening among older adults who may be paying college tuition or other major expenses. Overall, people age 50 and older held $6.6 trillion in debt in the second quarter of this year at a time when our economy is doing well. And last year, there were over 374,000 bankruptcy filings added to the credit reports of people over age 50. People over age 50 also represent the fastest growing segment for student loan debt. You think of the typical borrower and person with debt in their 20s and 30s, but $1 in $5 of every student loan dollars is held by somebody over age 50, either for their own education or that because they co-signed for one of the loans of their family. And it's not just tuition. 40% of empty nesters report they're still paying kids' expenses. While my daughter is about to head to college, I expect both of these issues are going to be huge in my family. More people are also carrying mortgage debt into retirement than in the past, increasing by 17% between 1989 and 2016. In the second quarter of this year, homeowners 62 and above took on almost $15 billion in added mortgage debt. Let me turn to today's topic on home equity. One of the single largest assets for most older adults is their home. The latest data showing that housing wealth for seniors hit an all-time record of more than $7 trillion. And while that may sound like a big pot of money, for most of the country, there aren't the crazy high home values like we have in DC. In most regions, home values are much lower and nowhere near enough to finance 30 years of retirement. Further, accessing home equity is not simple. You have to sell your house and downsize, or start renting, or maybe finance a mortgage, or you can take a home equity loan or reverse mortgage. And I understand the appeal of reverse mortgages, especially if you're talking about someone who has a large amount of home equity and a serious need to unlock some income. But at ARP, we do not see home equity or reverse mortgages as a major solution for all people for the retirement security problem. In our view, even transparent, well-designed reverse mortgages can only play a limited role in improving the financial outlook for the majority of people. The large aggregate number for home equity is somewhat misleading. If you're a homeowner, what matters to you is the value of your home and the equity in your home. The median home equity value in 2016 was just $145,000. Meanwhile, older adults are carrying more mortgage debt into retirement than ever before. While we don't know the exact number of reverse mortgage foreclosures, the evidence suggests it's too high. Borrowers still have to keep up with property tax, homeowner insurance, and maintenance, and many are overwhelmed by these costs. A recent GAO analysis found that more than 100,000 HECM terminations between 2014 and 2019. So we need to get a better grasp on why this is happening. FHA should require lenders to provide a reason for any termination, and it should make sure that the data are accurate. And more should be done to help older homeowners who fall behind on taxes and insurance. Mitigation programs need to be improved, and no one should be forced out of their home when they have just a minimal amount of delinquency. In conclusion, fixing the holes in retirement security will require a great deal of work on many fronts, but we really need to act now. Actually, we needed to act yesterday or a decade or two ago. Too many people have no savings, no retirement plans, little or no home equity, and only modest Social Security to get through each month. And the situation will only get worse if we don't address it. While better public policies are critical, private sector innovations are also part of the answer. We also want people to be equipped to help themselves and plan for their own future. But for that to happen, many need education and guidance. Now, I know I've highlighted a lot of problems, but I believe that by staying focused and working together, we can make tremendous progress, and we all can make a role in moving the ball forward. Again, I'd like to thank Ben Harris and Martin Bailey for this really important series where we focus on solutions to the retirement crisis. I have about 2 minutes for questions. Go ahead.
Thank you.
Hi, Julie.
Yes, it's Julie Nephew with the AARP Foundation Litigation, and I was wondering, I heard you say a lot of really important things, but I didn't hear you talk about enforcement against banks that are doing some really bad things with reverse mortgages and really taking people's equity and just basically stealing their homes. Can you address that a little bit?
Julie, you probably address it better than I do, so why don't you talk about the great work that you're working on?
Oh, well, I'm just trying to get to the point that I think that there's a lot of banks out there that are not, that have been originating these loans for the purpose of stealing the equity out of people's homes, profiting tremendously, and then, when it comes time for them to either enforce the loan, get the insurance benefits, the FHA fund, the MMI fund that holds the insurance for these properties for the banks is, $14 billion in debt because the banks are basically taking the taxpayer dollars after they've taken all the equity out of the homes. And I just think that, somebody needs to be paying attention to what are the banks doing and how are they getting away with it. Because there's not a lot of loans out there, but it's worth a lot of money. So that's all that I would say about that.
Said better than I would. Thank you, Julie.
Good morning, J.M. O'Connell, retiree. AARP has a lot of heft, and you referred to the problems of out-of-pocket medical expenses. And when I read various articles, I find that there's a gap in dealing with dental costs. And you know, for most people, it's not about cosmetics when you're in your 60s or your 70s. And if you have bad teeth, you don't eat right, you're in a lot of pain, blah, blah, blah. And yet, financial planners and people that you cite for often don't make clear if they're including or not dental expenses. So I wonder if AARP would be willing to use a little muscle with people in clarifying the role of dental expenses for the elderly.
Thank you for asking that question. So Medicare doesn't cover vision, hearing, or dental, three things which our body parts really don't often last until we're in our second half of our lives. It's a huge issue because it's not just your teeth, it's your ability to eat. Infections can cause all kinds of problems. I was excited to see in the House bill that is tackling the high cost of prescription drugs that they were adding using some of the savings to provide vision, dental, and hearing benefits. I think they should be a basic part of Medicare. I think that there are far too many people that suffer from untreated dental issues. So thank you for raising that.
My name is Ann Carson. I'm a retired lawyer and foreign service officer. I wanted, first of all, to congratulate your organization on taking a stand against reverse mortgages. In 1975, my first job with Essex Newark Legal Services, I experienced, on behalf of my clients, basically the same phenomenon that the woman already spoke about. Presented itself a little bit differently because in those years, of course, consumer unfriendly products like reverse mortgages were not allowed. I'd like to ask you what, if anything, can be done to encourage your organization to stand firm. A lot of research is happening and a lot of people are saying that older people need to tap into their savings. And meanwhile, the banks are thinking, aha, there's an assessment fee I can charge. There's an evaluation fee I can charge, et cetera. So how do we make sure that this reverse mortgage thing is tamped down? Thank you.
Thank you. Well, I want to be clear. They're not bad for everyone. There can be a use for them in some cases. But we take a very strong consumer perspective and have a lot of concerns with the current marketplace, with transparency, with oversight. I think Julie raised a whole bunch of the issues that AARP has been incredibly strong on, and we continue to be.
Could you just specify the case in which reverse mortgages would be better than perhaps a second mortgage?
I want to be careful about giving specific financial advice, but I know the next topic will be covering that in a lot more depth. I have about no time left, so thank you so much for having me today, again, for Brookings.
Thanks for watching. Be sure to like and subscribe for more videos from Brookings.